doing today?
I'm fine.
Good, good. Well, I'm just going to take your blood pressure.
Fine.
I might squeeze a little bit.
Does it matter? No, I'll put it down here. Fine.
Patients who have severe mental illness will die possibly up to 20 years earlier than somebody without a mental health diagnosis. So mortality of those patients is no better than anybody living in the 1950s, which is clearly unacceptable.
That's absolutely fine.
It's a huge problem. We know it's a huge problem. So what we're trying to do is bridge that gap so that their physical health gets as much attention as their mental health.
Hi, Dr. Nishad, I'm Dolly, one of the pharmacists. How are you?
When the patient is admitted, we will register them onto our centralised database, and we will then generate a pro forma with all that relevant information up that we've picked up from the clinical records.
Do you know if this lady is a smoker?
Once we've then flagged up where the gaps are, we will then process that information further and flag up where interventions are necessary.
The only one that's outstanding at the moment is a HbA1c, which is looking at her glucose regulation. So if you can get one of those done when she's ready to have her bloods taken, that would be really helpful.
If they're a smoker, for example, we may give some brief intervention or advice in the ward, or may refer them on to our smoking cessation services.
You want to have a look?
If somebody is overweight or obese, then the nursing staff will obviously give dietary and lifestyle advice.
I'm just going to call the junior doctor down, just to take some bloods, make sure everything's okay in there, and that's everything.
Right,
So
thank you.
Last year, with those patients who were on our inpatient wards who were picked up through this national performance target, which is otherwise known as the sequin, every single patient, almost 97%, got all the relevant screening and received interventions as appropriate to which ones were flagged up.
And if there's any interventions necessary as a result of that, then I'll obviously be in touch with you again. Okay, thank you very much for your help. Thank you. Bye-bye.
We're very pleased that here within Leicestershire we've managed to put a big drive behind the area that's been highlighted by the Mental Health Taskforce, in other words, integrating physical and mental health. And we're very keen and passionate about sharing our knowledge and information with everybody else in terms of what we've gained here and what we've achieved.